Hello, scholars. My name is Dr. Kerris Dillon, and the goal of this channel is to make academic subjects easier to understand. If you haven't already done so, please click the subscribe button and don't forget to like this video. That way I can keep producing the videos that you like best. In this last video, we covered somatic symptom disorder, and in this video, we're going to cover illness anxiety disorder. So let's begin. In order to be diagnosed with illness anxiety disorder, the individual has to have the following symptoms. A. The individual is consistently frightened that they have or are acquiring a serious illness. B. If the person has somatic symptoms, they are only mild. If the individual has a medical condition, their attention toward the illness becomes excessive. C. The individual has a tremendous amount of anxiety in regards to their health. The person may become alarmed concerning factors of their own personal health. D. The person will constantly check their body for abnormalities or will completely avoid going to the doctor or attending appointments. E. The hypervigilance concerning the person's own health has to be present for at least 6 months. F. The individual's preoccupation cannot be better explained through another mental disorder such as delusion disorder, OCD, body dysmorphic disorder, panic disorder, or somatic symptom disorder. The clinician will want to specify whether the individual is the care-seeking type, which means they frequent the doctor and have constant medical tests, or they are the care-avoidant type, which rarely, if ever, goes to the doctor. The diagnosis of hypochondriasis is not used anymore by clinicians, and so most individuals will fit under the category of somatic symptom disorder. A few others may fall into the category of illness anxiety disorder. This disorder means an individual is constantly preoccupied with the illness that they have or one that they feel is underdiagnosed. Symptoms don't tend to be present with this disorder. If they are, they're very mild. No matter how many medical examinations these individuals get, they do not turn up a disease or medical condition. The person's distress comes from the anxiety that they'll have about the medical condition or perceived medical condition. When the person does have a medical condition, in order to be diagnosed with illness anxiety disorder, they have to think about it obsessively and be preoccupied with it. Individuals with illness anxiety disorder are constantly thinking about their health and medical condition. These persons can become alarmed if they hear about someone else becoming ill or dying. They also become anxiety-ridden when they read reports on different aspects concerning health. When they visit doctors and are reassured about their medical condition or lack thereof, this does not seem to help their anxiety and can increase it. Concerns about one's health often interfere with the day-to-day living of the individual. The person's illness or perceived illness will become so important that they begin to self-identify with it and create a self-image that centers around it. They may spend excessive time researching the disorder or talk with family, friends, and physicians about their beliefs. This can become extremely frustrating to others that don't want to continue to listen to them. At times, illness anxiety disorder will become so bad that the person will avoid seeing other people or going places. Persons with illness anxiety disorders will often be seen in medical facilities more often than in mental health care facilities. Some individuals suffer so greatly from worry that they refuse to see medical professionals for fear of what they will say. They may go to see multiple doctors and be given the same diagnoses and can be physically or emotionally hurt by having medical tests completed over and over again. Medical experts can become frustrated with these individuals and over time miss a diagnosis because they've had enough with their behaviors. The prevalence of illness anxiety disorder is between 3 to 8% of the U.S. general population. Males and females tend to have the same number of individuals diagnosed with the disorder. This disorder is particularly difficult because it can be chronic and relapse can take place again and again. For those people that have too much stress in their lives, this illness can become more of a risk. Persistent health concerns can affect relationships in negative ways. It can also affect work and productivity. Illness anxiety disorder tends to be diagnosed alongside anxiety disorders as well as depressive disorders. These can include panic disorder, OCD, and generalized anxiety disorder. Over 60% of individuals that have been diagnosed with illness anxiety disorder have an additional mental disorder. There is also an increased risk these individuals will have personality disorders. All right, well, we have reached the end of the video. There's not a ton on illness anxiety disorder, so I hope you liked it. Thank you so much for coming and being a part of this channel, and I will see you and talk with you later. Bye-bye.